So today I want to take you a little bit to the future, not the far future, the very near future, and even the present future. But before that I want to take you to 2002 and a film called Minority Report. Has anyone seen that film? Minority Report? Well, a tough crowd. So that film depicts a very iconic scene where you see Tom Cruise in front of this huge screen, huge panoramic, transparent screen, manipulating data. All kind of data, everything, information, literally everything. All the information in the universe is right there in front of his eyes. And the way he's doing that is very intuitive, using hand control, hand gestures, everything. Remember, that was 2002, before we had iPhones, before we had all kind of games that use today, hand gestures. So I want to take you today and show you how we are about to realizing this vision that has three principles in it. One of them is visualization. Everything right in front of your eyes. Information, access to every kind of information you want. You as surgeons, preoperative data, whatever you need, right in front of your eyes. And usability. The ability to use your microscope or everything you use intuitively, like an extension of your body. And this is how we're doing it. This is from a true clinical trial. This is Professor Anat Levenstein from Ichilov. She's doing cataract surgery. What we're doing today is we have this headsets, and you can see that intraoperative augmented reality, true 3D vision. This is the first principle. We have the vision. Everything is right in front of your eyes. This is, of course, is a computer-generated image. She actually sees in her headsets, she sees these huge screens right in front of her. Everything directly in your face, in your eyes, everything you need. So the first principle we're achieving, and that's visualization. Next, we have information overlay. What you need when you need it. Right, so you can see here, you can overlay information on top of the operating area. You can view information on a side screen. Everything right in front of your eyes. Very similar to the Tom Cruise scene where he sees everything panoramically. You don't see, small screen anymore. Everything is there. And the intuitively of the usability of that device, we're using head gestures. They can't use the hand, right? You're a surgeon, you need the hands to do better things than manipulating devices. But we're using today head gestures in conjunction with foot switch. Not enough head motions you can do, but it's very intuitive. For instance, you want to zoom in, just lean your head. You want to focus in, focus out. You want to change the lighting, left, right. Everything is very intuitive. Very easy to use, very fast learning curve. And last but not least, surgical safety. With today's technology, we can actually guide you through the surgery. You can do pre-planning, and then we can show you where you want to do the incision, where you want to peel up the membrane, anything you want to do, we can show that. If we can use tool tracking and other high-tech technology, we can do that all in this system. And this is a prototype. As you can see, we've already started a clinical trial, both in Israel, in Ichilov, with Dr. Lowenstein and Professor Adiel Barak in Ichilov, and we have another clinical trial, that session we did in the United States. So this technology, where does it come from? Decades now, fighter pilots are able to use this technology in their missions. What happens to the sound here? But fighter pilots, like surgeons, need information right in front of their eyes when they need it. You see that? That's true augmented reality. That's what fighter pilots see, right? True augmented reality in real life, information coming to them, visualization, and the usefulness is they have eye tracking, right? So everything is an extension of your body, the same principle that are implemented here for fighter pilots. We're now taking that same technology. I come from Bionics. We are a small startup company. We're a spin-off from Elwood System. So we're taking these technology developed for fighter pilots and we're now implementing them in the OR, and especially right now for eye surgery. So what do we have in the system? So first of all, where the magic happens, that's the head wearable transparent display with head tracking capability. This allows us to do, one, the visualization, a very nice visualization. It's a 3D visualization, and the head tracking allows us to use usability of the system. Next, we have ultra-resolution cameras to look at the patient, look at the operating area. We envision that you can digitally zoom. That's why we have ultra-resolution camera. You can zoom in digitally without loss of resolution. And second of all, we have the proprietary processing core that enables us to grow the system, to upgrade the system as we go along, to add additional information, additional functionality, software application, everything you can think of that can be done digitally, we can do that with our software. So the head wearable device, this is where the magic happens, as we just saw. Let's see if that works. Very slow. But you can see here the virtual screens coming in front of her. This is what you see. You can have the visual screen floating in midair, or you can have them directly in front of you, moving with your head. So that one thing that is surgeon doesn't need to do anymore, that fix their head to those small eyepieces in a microscope. The information is always right in front of the heads. They don't need to be afraid of losing that. They can look sideways. It's there. They don't lose it. We have a see-through headsets. That means that you can see through that or make that opaque. We have an electronic shutter there that if you're operating and you don't want any interruption from the environment, you can close that and see the image, really high resolution. But if you want to see someone there, just move your head and automatically it will shut down and you'll be able to see through. Right? So we have that both either see-through and immersive. And look at that, that's not really like virtual reality, that you're immersed completely in your own world. There's still very, very large room on the sides and on the bottom of those eyepieces that you can orient yourself in the OR. You can see the sideways, just glance away and you see people. You can look down and see what your hands are doing. Very important for you. You don't want to be immersed in that virtual environment. So you do have that peripheral, so you can still see what you're doing in the OR. And of course, we have the head gesture. Those headsets are equipped with head tracking technology that can know what your head is doing, where you're looking, and that way we can control various aspects of the system. Multiple virtual displays. We talked about we can show you anything you want. And these are not just flat display. This is true 2D imagery. There's actually a sense of depth, a very acute sense of depth. So when you're doing those minute things, you actually see depth in your eyes. And of course, everything is in real time, very low, very zero lag, very no latency at all, actually. You're doing something, and immediately you see that. There's no image lag between what you're actually doing and what you're seeing. Next, we have the ultra-resolution cameras. As I said before, we're capturing a fairly large size of the operating area, and then you can digitally zoom in and scroll around that image very nicely with your head. You can actually look up and you see different areas of the operating area. And since we're capturing everything, if for instance there's a blood somewhere, we might be able to capture that and alert you, look, there's blood there, and go that way, because we're capturing the whole entire area constantly. Everything is digital. So we can enhance details, we can enhance artifact, we can overlay information, we can do everything that the digital zone enabled us, including even introducing multispectral vision that we don't have with a regular microscope, OCT, intraoperative OCTs, and whatever technology you like that can all be incorporated into those cameras. So a platform that we have basically allows us to do the whole package. We can do overlay, we can do image enhancement, and we can do guidance. Together with tool tracking and preoperative OCT that we can overlay the image, we can guide a surgeon and alarm him if he's getting too close to retina, too close to the posterior capsule. Whatever you need, we can do that, and it's basically endless surgical software application. Every application you can think of, we can start implementing that, and we are already doing that. So just a few examples: data overlay, preoperative OCT, fluorescent imaging. We can take those preoperative data, put them one-on-one on the real-life image that you're looking, so you can see images and you can see artifacts that you can't see in real life. You'll know exactly what to do when you need it. IOL, toric IOLs, again, you measure the lens curvature before that. We can show it to you in real time by image registration right on top of the eyes. And of course, preoperative OCT, we talked about the multiple screens. You can use that. You want to see something, you want to see where to peel, where the membrane is detaching. You can see preoperative OCT right there. All the information you need right when you need it. And of course, here you can see a small, this is actually an image that we've shown surgeon during surgery, just to see that, you know, additional information doesn't interrupt them in their surgery, but they loved it very much. In the future, we'll be able to actually hook up other devices in the OR, such as the phaco machine and other devices, and show you their telemetry right there in front of you. It doesn't interrupt your vision, doesn't interrupt the surgery. You just want to know what the aspiration is, what the vacuum is. You just glance with your eye, and there it is. You don't have to ask the nurse what the light levels are, whatever. You just glance and hear the information, everything you need, right in front of your eyes. Image enhancement. Of course, everything is digital. So we can image enhance. Try to turn that down a bit. I don't know why I can't lose the sound, but okay, so you can see the imagery, the image enhancement, and this is, you can see from the small, we're just starting to learn and to use all those special filters, but this is from an actual clinical trials. You can see, I don't know, the image doesn't do justice with that, but you can see a small change of the colors that the surgeon see. You can see better resolution, you can see better details that he didn't see before in terms of those scars, so you can actually tune down the colors that he sees to his operation. So this is from an actual surgery we did. You can see the colors changing, so filters, enhancing the image, these are all capabilities that we can do right now with the current prototype system. Tool tracking and guidance. So I don't know how to turn down the music. Oh, that's better. So you saw here in Children, as soon as we know where the tool is, we can alarm the surgeon if he goes too near objects. Tool tracking is sort of something, we have the technology to do that, and it's definitely something that we'll implement. Is all guidance to surgeon, making the surgery safer and easier to use.
That's the image that you have on your screen?
Yes, that's the image that you have on the screen. Here, look, this is the image you have on the screen. All the information right in front of your eyes, visualization. So these are from actual surgeries. You can see how the surgeon sits in front of that. He doesn't need to lean. He doesn't need to lower his head. Actually, many surgeons that put on this headsets, at first they lower their heads. That's a natural behavior. But as soon as they understand that the image doesn't go away, they start, relaxing, looking wherever they feel more comfortable. The image is always with them. And of course, they can use that with head motion. by tilting the head a little bit, the focus goes in and out. You want to focus on the tip always, so you just lower the down, lower the tip, lift up your head. Everything very intuitive, very nice. So this is the path.
How do you say? For example, you want an OCT. You want different image. You say by the. You
can either, yes, we're going that way. Today we're using a foot pedal. Okay. You just simply click that and you can change things. You click that and then the head motion is for focus. You click again and then lights. So today we're getting there, but today we're using foot pedal. Mm-hmm. You want to use voice command as well. For the binary stuff, there's then focus and then you move your head up and down and combine to the focus lights. Move your head. But yes, voice command will also be a part of that. It's a natural way of us to do. You use voice command today, but the one who's doing that is the nurse and not the system.
Yeah.
So we're now going to the system to do what you want rather than the nurse to do.
I have experience with this technology, different but the same system in refractive surgery, in corneal refractive surgery, in intracorneal ring segment. I have a lot of experience with intracorneal ring segment. It's very comfortable to do this surgery with this technology, or even for surgery, pterygium surgery is fantastic.
Yeah, very frees you. You can do better.
Some people look some photo with.
Which technology did you use?
With the LASIK. I have many experience in LASIK surgery.
Which technology is that? That's the True Vision? The Genuity?
Yes, True Vision.
Yeah.
Usually there is a small delay.
There's no delay here. In True Vision there is delay. We don't have a delay.
You improved.
Yeah, we improved. We improved. There's no delay. Zero latency here. That's all taken for fighter pilots. There's no delay in fighter pilots.
Right, the first time
there is a delay, but it's very small. I guess.
Yeah. But for us, you don't see any delay. You do something, it immediately appears on your headsets. The same technology for fighter pilots. If there's a delay in fighter pilots,
bye-bye.
Yeah.
A delay of microsecond in autopilot can be less critical than in a moving capsule.
You mean a 16 millisecond delay is too much? You think?
No, with the first technology, the delay exists.
Yeah.
With my technology,
but you don't
the delay is real.
In surgery,
in this moment, I think the delay is finished.
Yes.
Yes. With my first model, you have delay. Yeah. You need to be very.
I tried systems like this, and actually, you feel a bit uncomfort.
You're more than welcome to try this one. It's different. You don't see a screen. You see an actual 3D vision in your headsets. It's very different from just looking on a flat screen. So you don't see a delay. You don't need to tilt your head. You can look wherever you want. You can look straight ahead and do operation. Surgeon who done that didn't report anything regarding motion sickness. Nothing of a kind that you usually see from other technologies. Again, this is aviation technology.
No,
coming.
Obviously. And how many cameras are going towards the patient eye?
2. We have 2 channels, yes. So again, stereoscopic imaging and stereoscopic. That's why we have the actual, the true 3D vision in the stereoscopic image. You see depth. You actually see the depth. So we started, of course, with bovine eyes, and then quickly entered some the more easy procedures with silicone oil removal, and then very quickly went into the more sophisticated and elaborated surgeries. These are membrane peelings, laser endo, as you saw before, and you can see some images of that. There it is. This is one of the surgeries.
And you can do some OCT on the same time that you work?
Yes.
Like
we're right now doing want to implement intraoperative OCT in that design, yes, so you'll be able to see real-time OCT in real time, yes.
Crazy.
The technology enables us. No, it's so slow, but maybe fast a bit. You can see the depth of field that we have because we're using cameras. So we have a larger depth of field inside the eye, as opposed to conventional use. And you can see here The image doesn't do justice with the clarity and there's that the surgeon sees, but I think you get the idea and you get emotion and you get the... Imagine that you're seeing this real big in front of your eyes. Right? It's not a small thing. It's not through peeping holes. Big in front of your eyes, so you feel comfortable what you're doing.
Don't you think with this technology you end up with too much information going through to the surgeon? For example, in cars, there was a simple dashboard. Then it becomes more complicated. You got this, you got this, you got this. And you're having to take in too much information during the critical phase of a surgical procedure. That in itself may reach a peak, and then efficiency drops off. Okay? So
You're right.
there may be a learning curve associated. I know that first time I use a 3D, people use a 3D headset, they start doing this. They think they are moving. Okay? So you're not, you're keeping perfectly still, but you might have too much information. He's doing so, I need to check the OCT. What's that? Oh, I got to check. He forgets what he's doing.
Well, the technology needs to help you.
Yes.
The information, if you don't think you need the information, don't put it up there.
Yeah.
This technology enables you to do what you need to do when you need it. You know, one surgeon will like the OCT, another one will like something else. You can do whatever you like, and that's one of the things that we did and we tried to see that it doesn't interrupt the surgery. It's there, but you don't have to look at it. It's there when you need it. It's not there all the time to interrupt you. It's there when you need it. If you don't need it, don't look at it.
It's like with your phone. You have all these apps, all this information. How many apps do you actually use? You use very, very few. Your laptop, you have a lot. So what you're saying is you're giving these guys the opportunity to use whichever, inverted commas, apps for their ops.
Whatever apps they want. Whatever they can customize the system to their preferences, whatever they feel comfortable of.
So they can use any apps for their ops.
Yes.
I'm just giving you one.
The question, when you say before, combine the OCT with this technology. You can combine the technology. For example, I mix the 3D with barium in the same procedure. It's possible today combine this technology with another technology like barium, for example.
I was with a guy, the factory of the name is Babylon. He's come from England, and he's doing. We just not replace, like you say, to be more comfortable for the surgeon, but we just replace the ophthalmologist or the optometrist, and the OCT is better analyzed by the computer. All this photo, you just look, and in the future you will disappear like banker, lawyers, and everybody. It's already on the way. Perhaps a surgeon with these two hands, we have a little more delay, but not too much.
One of the things that you can do here is you pre-plan. Today, pre-planning is reserved to neurosurgery, brain surgery, spine surgery. But today, also with this technology, you'll be able to pre-plan, and then we can show you exactly, for instance, where to peel the membrane. You can pin and say, okay, this is where I want to peel, and we can mark that to you.
And go directly to... That's fantastic.
Yeah.
It's great.
You see here another great image. I'm wrapping up.
Great.
Let's see what else we have. Okay, so that's the last slide, a summary. So we have very high image quality, as I said. Visualization is a key factor here. We have that zero latency that enables you to do your job. Without that, this is nothing. Intuitive head gesture, usability of the system, very intuitive, very fast learning curves. You know, surgeon that we did that, just that few sessions with the system on a table, and that's it. They're ready for surgery. Very intuitive, very nice to use. Informatics, information can be inserted. Customize whatever you need. If you don't need it, don't use it. It's there for you. It doesn't interrupt you in the surgery. Image enhancement. We can, of course, show you things you haven't seen before or enhance details for you to see. And of course, the growth capability we are doing right now, developing all those applications, IOCT, IOL alignment, tool tracking, guidance, everything is in development, and will be, of course, available in the very near future.
Thank you.
That's it.
Thank you very much.
Thank you.